touching hearts and strengthening lives since 1904. Bethesda Lutheran Homes and Services Incorporated provides supports, resources, and worldwide outreach to people with developmental disabilities.
Let's have some tea with our lunch.
I don't want that.
But you usually like tea with your lunch.
I don't want that.
How about if we just fill it and leave it here
I
just in
said I don't want that.
Behavior is a message that can tell us important things about a person and their quality of life. Behavior does not generally occur without a purpose. Rather, behavior occurs for a reason. In this video, we will discuss how behavior serves as a form of communication, what an individual's behavior may mean, factors that influence behavior, and how staff interactions can impact a person's behavior and overall quality of life. This is particularly important if you support an individual who does not speak. Behavior is motivated by needs like survival, wanting to be loved, belonging, power, control, fun, and freedom. Each of us has a different level of need, but we all have needs. People will generally choose a particular behavior to meet these needs. So, how might a person's behavior tell you that they want something? When a person points to an apple on the table, they might be trying to tell you they want the apple, or they could be trying to tell you they are hungry. A person who approaches you with hands extended probably wants to greet you. Someone that comes to you with a toothbrush in one hand and toothpaste in the other hand and a puzzled expression on their face may be trying to tell you they need assistance. Some of the time, it is easier to figure out what a person doesn't want. Imagine if you couldn't speak. How would you let someone know that something is making you unhappy? A person who spits food onto their plate may be trying to tell you they didn't like the food, or maybe they were trying to tell you the food is too hot or too cold. The person who strikes out at you when you ask them to help you with the dishes may be trying to tell you they don't like doing dishes, or they could be trying to tell you they are busy right now and will do the dishes later. Some people have learned that making loud noises, acting out, or doing something wrong will get the attention focused back to them when there is a lot of activity going on. This type of behavior generally makes it difficult to be with the person. Behavior can also be a product of a certain environment that has been created. For example, an environment with limited space and limited sensory stimulation may put the individual at risk for engaging in unwanted behavior. Assisting someone during a difficult behavior can be puzzling, draining, and distressing. Remember though, it is also puzzling, draining, and distressing for the person having the behavior. When working with someone who is upset, emotional feeling can often stir up inside you. Your action should be motivated by the need to protect and teach, rather than being motivated by the need to control, punish, or fix people. Sometimes a person's behavior communicates just as well as a spoken word. The person's behavior may be an attempt to communicate a need to you. A person's behavior is learned by interactions with the environment and limited ability to perform certain skills. Limited ability to perform certain skills may lead to the person being unable to cope positively with their environment. For example, a person with no concept of money attempts to buy a candy bar. The person has 50 cents to spend. When they get to the store, they choose a candy bar that is 65 cents. All this person cares about is that they want this candy bar, and they have some money. Could this event turn into a behavior situation for the person? The answer to this question is yes. Remember, behavior is motivated by certain needs, so people will choose behavior to meet these needs. If we fail to listen to what the behavior is trying to tell us, the behavior may escalate out of control. Behavior can vary in severity and risk and is not always the same. Some behavior is mild and low risk, like shouting at someone. Other behavior is more severe, like tipping over a chair. Still other behavior presents risks to people and property. like the throwing of objects or striking out at someone. There are several factors that can influence behavior, such as internal and external factors, a lack of skill development in certain areas, and staff interactions. Let's first discuss the internal factors. Internal factors are how a person thinks about something. Does the person like it or not? Does the person have pleasant memories, or are they bad memories about the experience? If the person has an unpleasant memory about going to the dentist, this may be communicated by a sudden behavioral outburst when they are told that they need to go to the dentist. Is the person tired, thirsty, sad, or afraid? Ask yourself, is the person feeling well? How often have you experienced a general decline in your mood or ability to empathize with the needs of others when you don't feel well? Any sudden appearance of a behavior could be a signal that the person does not feel well. Illnesses as common as a cold or earache can result in a behavior as small as grumpiness or as serious as self-abuse. Behavior can also be affected by external factors. When behavior occurs, you should look around to see what is happening around the person that could be affecting them. What is the environment like? Is there a lot of noise in the environment? Is the environment too hot or too cold? Are there different or unpleasant odors? Is someone bothering the person? How is staff interacting with the person? Are too many demands being placed on the person? All of these situations can affect how someone will act in certain circumstances. Another factor to consider would be a person's lack of skill development in certain areas. For example, if a person can't zip the zipper up or down on a pair of pants, they would probably need staff assistance to go to the bathroom. In this case, the chance of becoming incontinent is likely. The frustration someone might feel at not being able to complete this skill might lead to a behavior situation. On the other hand, if they were a pair of elastic waist pants that they could slide up and down, this would allow the person their independence, lessen the chance of incontinency, and the possibility of a behavior situation. When dealing with behavior situations, consider your interactions with the person. Your interaction can bring either pleasure or affirmation or discomfort and confusion into the lives of the people you support. Interactions may or may not reflect respect and dignity, depending on the choices you make. Regardless of the nature or severity of someone's behavior, respectful interaction is still possible. Not only does your interaction with someone increase or decrease the behavior, your interaction can also help prevent behavioral situations. Let's take a look at the interaction differences in these two scenes.
I want to go to the doctor. I want to go by my sister. That's all I want to do. It's not funny. Stop. It's not funny.
Michelle,
No.
calm down. You don't have a choice in this. You're
I wanna
going to the
go.
doctor.
I'm going
Just
to
settle
with my
down.
sister.
Let's just
No.
leave this crab alone and let's go, Corey.
All I want to do is go with my sister. It's not funny. All I want to do is just go with her. It's not funny. All I want to do is go out to lunch like we normally do. It's not fair. I don't want to go to the doctor.
Corey, Michelle seems upset. Can you possibly leave us alone to talk for a little bit, please? Thanks. Michelle, I know that Corey teasing you upsets you.
I don't like that.
I know. And I know this isn't the way you usually do this lunch and stuff.
I want to go out to lunch with her.
Remember what you told me this morning, though, about how you were feeling?
Didn't feel too good.
Right. And if you're not feeling good, what do you need to do?
Go see the doctor.
Right. And what did I tell you your sister said she'd do instead of going to lunch with you?
Give me a call.
Yeah, and I think she even said she'd stop in tonight just to see how you're doing.
I guess that's okay.
Yeah, and then once you talk to her, you can figure out when you can do lunch another day. And you'll be feeling better anyway and have more fun then, probably.
I guess so.
Okay, well, you have a little bit of time before we have to go, so why don't you relax a little and then we'll get ready and go. Okay, thanks, Michelle.
You may have noticed how the staff acknowledged the person's feelings. I know it makes you angry when Corey teases you, and I know this is different from the way you usually do it. It is important to ask the person questions and acknowledge their feelings. Always remember to investigate the factors leading up to the situation. Maybe the person is sad about something, or maybe they just want to be left alone. Even when the person is nonverbal, asking questions communicates respect and concern. Watch closely for verbal and nonverbal responses. The way staff act and respond to a behavior situation can determine the outcome and if the behavior will happen again. The more excitement staff create over an incident, the more severe the problem can become. Perhaps the most important technique for any direct support person is the ability to develop a good sense of rapport with someone. Rapport is developing a relationship of mutual respect. Rapport starts with the acceptance of the other person's point of view and their style of communication. When rapport is established, you know what the person likes and doesn't like, so you can create a situation they like before they ask for it. Friendships are built on common experiences and shared circumstances. Having rapport does not mean that you have to agree, but that you understand where the other person is coming from. When you build rapport, you'll create deeper, more meaningful connections with people. Have you ever experienced anger, frustration, loneliness, or fear? How about joy, sorrow, or excitement? The people you support feel these same emotions you and I experience. Their reaction to things that happen to them in life are often no different than how you or I react. They have the right to feel upset, frustrated, angry, and sad, and they have the right to express their feelings, especially when they are in their own home. This only becomes a problem when it infringes on other people, shows someone in a bad light, or interferes with the function of someone's everyday routine. When you or I are faced with behavior situations, too often the tendency is to react or personalize the behavior. In other words, you assume the person is attacking you personally, and then you react to the situation negatively. Ask yourself, what are some of the factors that may be triggering the behavior, and how can I help support the person? It is important to recognize elements in the environment, a person's medical situation, or problems of communication that may be contributing to the problem. What you do or don't do as staff will have a significant impact on the actions of the people you support. You must evaluate and assess your own behavior, including your own style of communication. Consider these staff actions when you are trying to determine what contributing factors are encouraging the behavior. What does your voice sound like? Is it harsh, loud, or demanding? When you speak, you communicate many meanings that do not exist in the words themselves. You may strengthen, weaken, or even contradict the words you speak through the tone, pitch, and emotion of your voice, as well as the breath, speed, and volume you use. Remember, when interacting with people who are angry and upset, your action should be motivated by the need to protect and to teach, not by the desire to control, punish, or fix. Ask yourself, have my actions become physical, parental, or controlling during the behavior? If you come across as too controlling or parental, you will probably face some resistance. This is not your role, and these interactions on the part of staff can certainly serve to escalate a behavioral situation or create one. Facial expressions and body language can be interpreted as threatening. Your face is the most expressive part of your body. What is your facial expression telling the person? What we say, how we say it, where we say it, when we say it, and why we say it can cause a wide variety of responses from the person we say it to. When our words do not match what our body is saying, we give out mixed messages. Then the person can be in a great deal of confusion and anxiety. You convey more information through your facial expressions than through any other visual language. What is your body language telling the person? Are you standing with your arms crossed? Are your hands on your hips? Are you positioned too closely? Crowding the person or infringing on their personal space can influence whether you reduce or increase your chances of helping the person work through the situation. Respecting a person's personal space may make or break effective communication. Are there other actions you are showing that may be a contributing factor to the situation? Communication that is non-threatening and non-directive will often produce honest and genuine responses. You have a responsibility to offer supports for people to change behavior that is dangerous, disruptive, or interfering with their ability to achieve goals for themselves. However, this must be done in a way that includes the person. Remember what we said earlier. Respectful interaction is possible regardless of the nature and severity of someone's behavior. Now, let's take a few minutes to talk about redirection and lead time as intervention tools. Redirection is non-physical and focuses the person's attention on some other activity or location away from what was causing the behavior situation. When you use redirection, continue to teach by explaining what the necessary behavior is, and then identify the desired behavior or alternative. Look closely at the following example.
Hi, Gary. Corey, why don't you pick something out and I'll be over the table when you're done, okay?
Can I help you? What can I get you today?
I don't know.
Would you like this kind?
Yes.
It's 65 cents. You only have 50 cents. You need 15 more cents. Would you like to pick something else?
No. No.
You're a little short on money today. Would you like some chips or candy from up here?
No.
You want to pick something else?
No.
What's up? Oh, you don't have quite enough money today. You could either have something from on top, or you have enough money to go play a video game. What would you prefer to do?
Sure.
Okay, let's go play a game.
Did you notice how Ellen focused Corey's attention away from the situation? By preparing yourself to act on and acknowledge the person's ideas and providing plenty of lead time when making a request, you give the person the opportunity to process and react to the request or situation. This allows the person to have some control over their life. The amount of lead time needed varies from person to person. It is common for a person needing assistance to experience loss of autonomy and self-direction. Autonomy means the person has the ability to make decisions about everyday routines and activities. Be aware that sometimes you can become too controlling in your role as a direct support staff. Develop sensitivity about when to provide support and when to promote choice autonomy. It is essential to offer choices to people whenever possible. These choice options shouldn't be limited to yes or no. For instance, to say, "Do you want to get out of your chair?" when someone medically needs to change positions is a yes or no question. The person needs to move for their health. Instead, you could say, "Would you like to move to the chair in the living room, or would you like to lie down in your bed?" Examples of other autonomy situations would be, "Would you like to go to your room and talk, or go outside and talk?" "Would you like to take your bath now or later this evening?" "Would you like to go out and see a movie or go to the store and rent one?" Remember to always try to give choices within limits. People are more comfortable and more willing to cooperate when they have some control in the situation. Once a behavior has been resolved, you still have work to do. Your emotions and the emotions of the person may still be on edge even after the situation is over, so you need to remain calm. Be honest with yourself about what happened. Consider everything that may have contributed to the behavior. This would include both your actions and the actions of the person. Ask yourself, did I help or hinder this situation? Did I actively listen to the person? Active listening is part of a trusting relationship and always conveys respect for the person. The person's behavior may be the only avenue they presently have to tell you if something is wrong. Discuss what happened with the person and help teach better ways to handle the situation. Once everyone is calm, remember to document the event. Make sure your documentation is complete, clear, objective, and non-judgmental of everything that occurred. Good documentation is about facts, not opinions. Follow your facility's policy on documentation of any behavior situations. Now let's take a few minutes to summarize the main points of understanding and supporting behavior. Behavior is a message that tells us important things about a person and their quality of life. All behavior is not the same. Behavior varies in severity and risk. When interacting with people who are upset, our actions should be motivated by the need to protect and teach. There are several factors that influence behavior. Internal factors. Internal factors are how that person thinks about an issue. External factors. External factors are things that happen around the person in the environment. Behavior may reflect lack of skill development in a particular area. Staff interactions. Your interactions may or may not reflect respect and dignity, depending on the choices you make. Respectful interaction is possible regardless of the nature and severity of someone's behavior. Establishing rapport is developing a relationship of mutual respect. When you build rapport, you create deeper, more meaningful relationships. Provide ample lead time and frequent use of redirection. Offer choices to people whenever possible. People are more comfortable and more willing to cooperate when they have some control in a situation. Do complete, clear, objective, and non-judgmental documentation of everything that occurred. By getting to know the people you support, you will discover the things that are most important to them and what gives meaning to their life. The approaches and techniques you use should enhance the person's quality of life, not take away from their rights and opportunities.